All right, everybody, we're going to go ahead and get started. Thanks for joining. We really appreciate it. Got a good group here. So appreciate taking the time out of your day to do this. We've got Rebecca Hansen and Jill Underwood here to do a presentation, as well as they have a kind of an example case and some questions to hopefully get the discussion going afterwards. But also, there'll be time for Q&A and anything else we wanted to discuss. So please don't be shy when we get to those points. You can unmute, you can raise your hand, you can use the chat feature, whatever is most efficient for you guys. And for those who haven't done so yet, please go ahead and put your information in the chat for intros. I see people are doing that, but we're looking for your name, your email, and your organization. So we appreciate that. So now I'm going to turn it over to Rebecca and Jill. Jill, you should be able to go ahead and share your screen and take it away.
All right. Hey, everybody. Can you hear me all right?
Yes.
Great. Well, good afternoon. Thank you so much for joining today's Project X Echo Campus series on mental health. I want to thank Carolyn Canini and Jay Mason for inviting Reaching Spectrum Heights to present today. I'm Becca Hansen. I'm the Executive Director of Reaching Spectrum Heights. Our company strives to provide individualized supports for young adults with autism spectrum disorder, especially during times of life transition. Today, I'm honored to present with a longtime colleague, Dr. Jill Underhill. She's an associate professor of communication studies at Marshall University, and she's done extensive research in the areas of providing inclusive environments, stigma regarding people with autism spectrum disorder, and peer knowledge and information. So today's kind of an epic day for us, at least in my head, but Jill's going to begin for us.
Thank you, Becca. And thank you all again. I know everybody has busy schedules, but we are so excited to be able to talk with you all about this topic. Before we begin, I just want to note that we are going to use both person first, so a person with autism or a person on the autism spectrum, and identity first, autistic person language in this presentation to reflect the preferences, the varied preferences of people in the autism community. I also want to define a couple of terms that we'll use multiple times in this presentation. One of them is neurodiversity. And neurodiversity is the belief that neurological variation and difference is natural and normal and has been with us since the beginning of, humanity. And so therefore, it's not something to just solely pathologize or something to stigmatize. We'll also refer to neurotypical peers, sometimes also called autistic peers. Those are just, in this case, non-autistic peers, especially in a college situation. And so with that, I am happy to share that according to the College Autism Network, more students on the autism spectrum will enter higher education during this decade than any other minoritized group. With supports in secondary levels and accommodations becoming more widespread, awareness growing, more students are tracked for college. And many of them come with a wonderful set of strengths, including academic aptitude, passion, deep interest, and lots of things that are going to make them successful in their academic studies and in the job world. But they also come to campus with a variety of challenges. And the challenge that we want to focus with you all today on is mental health and mental well-being. It is estimated that persist to graduation, so they do not graduate, oftentimes can be attributed to mental health related concerns, mental health related barriers. And so it is a significant barrier for being able to get students to persist to graduation. It is estimated that almost all, a vast majority of autistic college students come to campus with a comorbid mental health issue or disorder. There is a lack of comprehensive data about autistic college students, but I want to share with you some of the data that exists about autistic teens and young adults that I think we can extrapolate and likely underestimates what we're seeing on our campuses. So depression is one of the most common comorbid conditions that autistic teens and adults experience, with an estimated rate to be 4 times higher than their neurotypical college peers. Anxiety is also widespread across the lifespan of someone with autism, but especially at college, whether that be generalized anxiety, social anxiety, separation anxiety, or phobias. Estimates push upwards of 80% for the number of college students who suffer from anxiety, and about 50% come to college with a formal anxiety diagnosis. I did read in one study kind of preparing for this, just looking at anxiety across the board, and you all probably know this better than I do, but in a pretty large data set, over 90% of college students, they basically looked at all college students, reported having high levels of anxiety in college. And then that was slightly higher, over 95% for the autistic student sample there. So we know that anxiety is kind of at an epidemic level on our campuses and is something that creates a huge barrier for all students, especially those on the spectrum. Disordered eating is another one that I wanted to mention, as it affects upwards of 30% of autistic adults, although it's very underreported. I think, in my own personal experience, we don't tend to see that until the symptoms worsen. But that is something to also keep in mind as a really kind of common struggle of autistic students on campus. OCD, anywhere from 10 to 20% of autistic young adults meet the criteria for an OCD diagnosis. Those can be really hard to separate out because you'll see similar patterns in repetitive behavior, ritualistic thinking, inflexibility. But oftentimes what we'll see with OCD will be kind of that step further that we often see, right? Where there is no kind of ability to talk through flexibility, whereas sometimes with autistic students, we can use strategies. And so that is also a very common comorbidity. And then last but definitely not least, because it's very serious, if we look at suicidal ideation, pooled prevalence rates from a meta-analysis that was published this year, which is kind of the most reliable data we have on hand, shows that among autistic adults without intellectual disabilities, which is kind of the college population we're talking about, suicidal ideation rates are around 35%, which we know is higher than neurotypical peer population, with about 22% of those autistic adults making plans and about 25% with either attempts or behaviors that mirror attempts. And so overall, we're going to definitely move towards optimism and hope and all the things that we can do. But I definitely wanted to set the foundation with a really clear understanding that not only do autistic students come into higher education with their own struggles, many having experienced traumatic events, and so trauma being there as well, but oftentimes also with these comorbid conditions. And so regardless of whether they actually have a diagnosed comorbid condition, there are factors that can influence autistic student mental health, both internal and external. And so I'm going to turn it over to Dr. Hansen to first discuss the major internal factors that can influence mental health.
Thanks, Jill. Yeah, so as she mentioned, there's two different types of factors that are going to influence the mental health of individuals with autism. So first, let's look at these internal factors. What comes to mind when you hear the words executive functioning? It might be something like struggles with time management or organization, but really there are 8 different types of executive functions. They include impulse control, emotional control, flexible thinking, your working memory, self-monitoring, how to plan and prioritize events and tasks initiation, and then organization. So juggling complex assignments on tight deadlines that college students sometimes face while independently managing a schedule full of classes, having social obligations, bills, can cause a lot of anxiety and affect the mental health of people with autism. And it can lead to heightened anxiety. Same thing with sensory processing challenges. So some sensory sensitivities might include an overload with loud noises, bright lights, flashing lights, maybe strong smells, or crowded spaces. Sometimes people have either hypo or hyper simulations in terms of sensitivities to these types of sensory issues. It could be things like tactile sensory issues, food preferences, and things of the like. Lastly, we wanted to mention cognitive flexibility. And so cognitive flexibility really is your brain's ability to adapt to new or changing experiences. Many people with autism struggle with unplanned events or changes in their routine or schedule. So challenges with adapting to change can really affect the cognitive flexibility of someone on the spectrum. Next, let's talk about the external factors. So some of the external factors are going to include social communication challenges, and this is one of the root symptoms of having ASD. First, the communication with others, verbal communication. It might be communication in terms of email. It might be in different environments. And how individuals with autism communicate can be very odd at times, but definitely something that we can communicate better with and understand. Some of this can also cause external stigma placed on the self because of having autism. These kind of stigmas from the public can also breed prejudice. They might be dismissive of autistic experiences. The constant pressure to feel normal can really be exhausting for people's mental ability through the day, and can also produce isolation. So the internalization of some of these stigmas can be affected whenever they're not meeting the social demands or academic norms across campuses. Jill, I think you're going to share a little bit about the coping strategies that are consequences of these factors.
Yes, thank you. Let me make sure I unmute. No amount of pandemic teaching has ever quite gotten me there. So I'm definitely wanting to build exactly on what Dr. Hansen was just talking about with those external factors, and then how these maladaptive coping strategies that autistic college students will use further exacerbates their mental health issues. And so those external pressures, along with the internal pressures, will oftentimes cause autistic students to attempt to mask. And so autistic masking refers to purposefully hiding or suppressing external autistic traits. So whether that be stimming behaviors, which sometimes people need to do to relieve stress, facial expressions, how you hold your face, vocal tones, body language, all of that nonverbal communication that we talk about as being so important for impressions and how we communicate with each other and read each other. And so really what autistic masking is about is the student will very consciously try to control their outward appearance to mask their autism markers and to kind of fly under the radar from other people's perceptions. And so they're trying to pass, right? They're trying to not appear to be different. And that takes a tremendous amount of work. With that also too comes camouflaging, which is a little bit broader because that encompasses both your internal thought processes and your cognitive patterns. And so someone who attempts to camouflage will not only do the masking behavior where they're thinking a whole lot about what am I, how am I appearing in this space? Is anybody picking up on anything? Is anybody checking, noticing that I'm fidgeting or things of that nature? But then it's also things like I basically have to do things that make me uncomfortable. So for instance, when the autistic person will force eye contact, even though it's difficult, when they will try to mimic neurotypical speech patterns or language, even though it feels unnatural to them, it doesn't feel authentic. And spending a lot of time attempting to predict and analyze other social behaviors to strategically fit in. And so we can think about camouflaging as almost trying to become like a social chameleon, right? So I go into a situation and I'm trying to basically read what other people are saying, doing. I'm trying to mimic that. I'm trying to mirror that. But I'm also on a deeper level trying to change myself in a way. So that my thought pattern, my reaction is one of I have to think about how to strategically fit in every single situation. Now, for those of you who have experienced this, whether you have social anxiety or on the spectrum yourself, you know that this can be exhausting and absolutely depleting, and it frequently leads to exhaustion and burnout. What oftentimes also happens with that is that more maladaptive coping strategies are used to try to kind of stave off those negative feelings, those critical thoughts, the stigma, all of those types of things. And what we see frequently college students going towards is substance use. And so we know that oftentimes students, who are in college generally will have more access to substances than ever before, but that autistic students are more likely to try different kinds of substances to, honestly, and this is me taking a little bit of a leap from the literature and research, but to self-medicate. And so one study reports that about half of autistic young adults will either have substance misuse, abuse, or addiction at some point before they kind of reach full adulthood. The most common by far is recreational drugs. When we look at kind of levels with alcohol and some of the other substances, actually autistic students are less likely to consume alcohol, but they're more likely to consume things like marijuana. And again, I believe it's really important to note that this is likely a self-medication strategy in many cases. If we look at the disparity between the number of autistic people who have a diagnosed mental health comorbidity, the number who report these symptoms of mental health, either disorders or conditions or struggles, there is a huge gap. Research shows that approximately 35% of autistic adults take prescription medication that is related to a mental health condition. And so if we know that we're pushing upwards levels, much higher rates of prevalence, it's not that every single person needs medication. Obviously therapy and all those kinds of things are important too. But I think what you'll see with this is that oftentimes college students may turn towards self-medication with substances before they express a willingness or an openness to seek out potentially pharmaceutical interventions. And so that is just something, as you're working with college students, on campus, bringing up these ideas, I think especially with the now very ubiquitous smoke shops and things that are within walking distance of many campuses, that are legal products that you can buy above, 18 and 21, that we're likely going to see an increase in this as a maladaptive coping mechanism, even more than we're already seeing. The last thing that we wanted to mention that's really important for college students too, that is related but not quite the same, is numbing behavior. And so we all numb, and we all have our, numbing mechanism of choice. But oftentimes what we see with autistic college students, and I see this in my role as a professor, is that because they are so much more worn down, exhausted, burned out, those kinds of things, they are likely to need more recovery time, restorative time. And when they don't do that in an adaptive way, they tend to just numb for an unhelpful number of hours. And so this will start to show up in their academics. They're not going to be turning things in on time. They're going to be missing class because they stayed up really late watching YouTube videos. And of course, there's the stereotypical playing of video games and different behaviors that college students do. It doesn't really matter what the strategy is. If they're doing it to an unhelpful level because they don't have adaptive coping strategies, then it's really going to interfere with not only their academic success, which is important as they are in college, but also their overall mental health and well-being. And so I know that Dr. Hansen in her work, and I've also seen this too, really try to focus on helping students find adaptive coping strategies, helping them find things that are restorative to them, encouraging those kinds of activities on campus, especially, things that are available that are free to students, that will help them deal with all of the ableism, the stigma, the distress that they are feeling from that college environment. And so what we see is a greater need there than you may see with other students who are also experiencing, mental health issues. And so with that, I'm going to turn it over to Dr. Hansen to discuss strategies on ways that we can support autistic students' mental health on our campuses.
So thanks so much, Jill. I feel like she's kind of telling us all the things that are like, oh no, this is not going to be good. But we want to definitely finish with a picture of hope about how everyone can embrace neurodiversity. I'm guessing this isn't the first time that people have heard this popular term, but really it's just a difference in the way that the brain functions and processes information. So our goal really is to create that inclusive campus community. I recognize through the chat that we're representing all parts of the state of West Virginia. And so I'm super excited to see counselors and other support staff who are tuning in and becoming allies through a training like today. We also want to be able to provide holistic accommodations. And so what that really means is making things available to people. Having the ability to let people who are neurodiverse focus their energies on learning and making connections rather than having to mask and have that mental exhaustion of trying to fit in. Providing academic accommodations that are helpful. Most professors that I've had the opportunity to work with have been over accommodating and saying this kind of accommodation that you're asking for, be it a change in the light setting or a different quiet room or a little bit of extended time, is something that most of my students can utilize anyway. So providing those academic accommodations can be helpful. And same thing in a clinical environment too, creating the sensory adaptations that people might need in order to have that time of decompression. Sensory adaptations can come in a lot of different forms. It might be flexible seating arrangements. It might be a place where people can have stimming behaviors for whatever amount of time they might need. But really, these things are going to foster greater inclusion and have more access for people with autism, especially college students, to find that safe environment. And then, Jill, are you going to mention a little bit about social supports?
Sure. Did you want me to pick up with training, or do you want me to go just to?
Yeah, training would be good, actually.
Okay. So as we're, talking about kind of this experience right now, this represents the type of training, but there are many other types of training that are available in terms of helping not only yourself be able to potentially identify students who have not yet been diagnosed or who may be neurodivergent, but there's also a variety of trainings available for campus communities. And if you are somebody who is interested in these kinds of resources, we would be happy to share the things that we know about. For those of you who are familiar with Marshall University, we have an Allies for Autism Spectrum Diversity training. We also, I was in the Center for Teaching and Learning, have done a number of universal design for learning trainings as well, which are a big part of how do we build in multiple pathways for success within our classrooms and within our campus systems. There are also some really excellent trainings that are provided by organizations like, if I'm thinking about the Organization for Autism Research, OAR, Aspire, Drexel University, and others who will offer a variety of ways to learn about not only autism, but also neurodiversity, which includes ADHD, OCD, bipolar disorder, different types of neurodevelopmental disorders, of which autistic people often have dual diagnoses as well, learning disabilities, things of that nature. So just understanding kind of what information you need. And again, those things are out there for you. The College Autism Network is another great place to get training. Reaching Spectrum Heights, which is led by Dr. Hansen, is another opportunity for trainings for not only clinical staff, but also the campus community. And so there are a number of things that are already available and can really make a difference. And then once we kind of embrace that almost train the trainer model, with these different kinds of information, you're then able to go out into your campus and help others and train others, whether that's faculty, staff, or peers, or actually, and we'll talk about under self-advocacy, autistic students themselves. And so training has really, I believe, gone a long way on Marshall's campus. In my own experience, being there for the last decade and seeing an increase in inclusion and acceptance and understanding across our campus. In addition to these items, some other things that we really want to look at how we can build capacity on our campus is the idea of social support networks. Now, we oftentimes find that, autistic students, about the same number are extroverted as introverted in the general population. And so there's kind of this myth that autistic people tend to be more introverted. And that is false, because introversion and extroversion isn't really correlated with that. It just appears differently, right? And so you may read somebody as introverted who is on the spectrum, when in reality they are craving interaction, belonging, dealing, with issues of isolation. And so social isolation and loneliness, though, are common challenges for autistic students, especially those navigating college life during that transition in, while they're there, and that transition out. And so really what we're looking for is connection, community connections, relationships, and fostering that sense of belonging, which is really vital for both mental and emotional health. We do not oftentimes look at social support networks in the same way that we might look at for typical peers and building those in that sense of belonging. Friendship is a pretty high bar. And so oftentimes what we're looking for instead for these students is multiple points of connection. And so ultimately we hope to foster friendships. We want that to happen. But really what many of these students need when they are on campus, especially at the beginning, is some sort of network. And so that does not have to be just their peers. That can also be faculty members, that can be a staff member. There are, autistic students that I work with that are close with people who work in their dorm or custodial staff, somebody that they feel like they can talk to and that they know and that knows them. And really research has shown, just from an academic side, when a student feels connected to their faculty member, like they can talk to them, and one other peer in the class, so not a whole bunch of people, but one other peer in the class, they're significantly more likely to persist in that class. And so what we want to do is we want to build these networks, and they don't have to look like friendship groups. They don't have to look like all peers. It just has to be, I have people in this community that I can go to. We know that anxiety and depression will worsen without support. And so networks that can also help with coping strategies, people who can offer some mentorship that's kind of attuned to autistic experiences, can make all the difference. One way that you can create these networks on campus, if they don't kind of naturally exist, or you're looking for a more systematic way to do this, is to partner with student groups, especially those that promote disability advocacy or neurodiversity. That organization didn't really exist at Marshall, so we started the Neurodiversity Alliance last year, and that has really gone a long way for building those kinds of connections and community. I wouldn't necessarily say that they're all, best buddies or anything like that. But what we do is we talk a lot about empowerment. We talk a lot about advocacy. We talk a lot about kind of strengths-based types of things. We do fun social things together. And that has created a safe space for many of our students who aren't necessarily yet connected with other student organizations. What we then do is partner with other student organizations and try to create those connections. And so it's not just, a small group of neurodivergent students doing everything together. We are also then kind of hosting events and doing things with other folks across campus. And so this could be a formalized type of social support network. It could be an informal network. Hosting groups is another way to do this. That we do this in Reaching Spectrum Heights for those who are usually alums of college out in the working world. Creating those opportunities to gather virtually has really gone a long way for many of the clients that we serve, and many of the former students that I know as well, just having a place to have connection. In addition to that, and closely related to it, is also offering self-advocacy training or encouraging self-advocacy training. There are a number of key reasons why self-advocacy training can really make all the difference for autistic college students. The first is when they have some instruction, some knowledge about disability legislation, civil rights, and available resources, that empowers them to be able to identify whether or not they're receiving what they're entitled to under the law. And seek out reasonable assistance and inclusionary policy changes when needed. And so it helps them understand that this is, something that they are entitled to under the law. And I find that many of our college students don't have that information. They haven't been instructed on those kinds of things. Self-advocacy also helps develop needed assertiveness skills that oftentimes many students on the spectrum lack and helps them with their communication skills to be able to state their needs, whether that is sensory accommodations, learning supports, flexibility around socializing, modifying group work, flexible attendance, all of the kinds of things that we're seeing that are also associated with mental health accommodations. Training can strengthen their negotiation skills for obtaining and really kind of normalizing the use of accommodations without any kind of shame or discouragement. And that will translate to when they leave the university and go out into the work world and are going to need the same types of supports to be able to be successful in their job. What we want to do too is we want to, through self-advocacy, help them form a worth, self-identity, and a sense of pride around their kind of authentic autistic self. And that will help them feel like they need to mask less and that they have the opportunity to build some self-esteem to overcome the stigma and the ableism that they're going to face, whether it's on campus or out in the world. So we find that self-advocacy is one of the most powerful tools to be able to support mental health. Therapeutic interventions of different kinds, and I know I'm speaking to the experts about that, are really important. What we know for autistic college students is that when they are strength affirming, when they are kind of identity centered, when they're trauma informed, and when counselors have some fluency in the autistic experience, therapeutic interventions can make all the difference for unlocking vital tools, insights, and access that oftentimes autistic students need to kind of fully realize their personal potential while also kind of healing from the ableism, the trauma, and the stigma that they faced throughout their entire life, and making them more resilient for those things that they will face in the future. We know too that many autistic students have perfectionism issues that are tied to their identity and self-worth. And this can lead to an immense amount of distress, especially when it comes to academic evaluation and kind of what is the typical parts of the college experience. And so therapy can help with unhealthy belief restructuring, increasing distress tolerance, and self-compassion. Sensory integration therapy is oftentimes really helpful to develop coping mechanisms and self-regulation strategies to persevere through the many overloads and triggers that students are going to face in college environments. And then I also wanted to mention too that dialectical behavior therapy, DBT, and Acceptance and Commitment Therapy Act are showing a lot of promise for autistic populations. There's not a really deep or solid body of research there yet. But if you are working with a student and finding that kind of typical traditional CBT or ways of doing things are not necessarily reaching that student, that these alternatives are showing a lot of efficacy for college students. And last but not least, coaching. Coaching can be tremendously helpful for supporting not only autistic youth, but college students and adults in numerous ways. And so as Dr. Hansen alluded to, executive functioning deficits are very common for autistic students. And so executive functioning coaching can help build essential organizational planning skills that are necessary to manage challenging assignments, complex workloads, and variable time schedules, which creates some of that stability amongst the chaos of college life and beyond. Social coaching offers critical guidance in navigating kind of nuances around especially neurotypical communication norms, how to forge friendships, how to master things like small talk, which I don't necessarily know if that's something you can master, but the idea of it, right? Like you feel competent in your ability to make conversation and just expand your communication competencies. Life skills coaching can help with daily living activities, from financial literacy, healthy habits, responsibilities, or that students have and then will have in their household, to vocational preparation and identity building. And all of these things help foster independence. The more independence that an autistic student perceives that they have, usually the higher level of self-worth and self-esteem they have. And oftentimes we see a little bit increased mental health well-being from those types of things. Job coaching as well can be really helpful in terms of interviewing, self-advocating needs, helping them excel in internships and then later in careers. They're aligned with their passions and talents, the things, the strengths that they're bringing to our campus and then taking to the workplace. And when an autistic student has an affirming coach who helps them understand ambiguity in terms of expectations, co-strategizes solutions with them, motivates their progress, they are able to gain a lot of self-awareness and really launch into adulthood with feeling supported and having practical tools that they need to basically be able to transform the adversity they have faced into success, which again leads to higher levels of mental well-being. And since coaching is really what Reaching Spectrum Heights is all about, I'm going to turn it back over to Dr. Hansen to let you know how you can learn more about what RSH does and our group services and how to contact us.
Thanks so much, Jill. I really appreciate everybody's attention today and this opportunity again to share some information about supporting college students with autism. I actually resigned from Marshall University in 2021, and I desperately missed the interaction with students, especially people who are neurodivergent. And so I established a company with my husband called Reaching Spectrum Heights, which brought about the ability to provide consulting services to both parents and young adults that have either siblings or the person themselves has autism. And then I recognized that one of the best things that we did in the formation of supports when I was at Marshall was providing that group environment, just something to do, be it on the weekend or even virtually in the capacity of Reaching Spectrum Heights. And so that's been a really rewarding experience where adults on the spectrum, especially those who have graduated from college and are entering the workforce, or maybe having challenges with finding meaningful employment, maintaining employment, focusing on transportation skills, learning how to drive, things of that nature, financial management issues. Many college students have to go back to home and live with their parents. And so some clients are focusing on earning enough money to have their first home, but a lot of different variety of life seasons. And so that is kind of how it was founded. One thing I wanted to share, and I know Jay had mentioned we didn't have anyone submit a case study, but I had some just basic information to share about supporting people with autism as they navigate the campus environment. But before that, this past Sunday, I noted something that some of the group participants were asking about. And the question was, what's something that you wish you would stop hearing from neurotypicals? And I took really good notes on this. And the feedback was, stop telling me to look at you. You've got this. Stop acting like I'm a child. It's really harder for me. Stop being dramatic. Calm down. Don't interrupt, but talk enough. And so these types of skills that they were sharing that they struggled with, and this is a population of people of all genders and ages, but predominantly between let's say 17 and 42, that are sharing experiences about how they perceive the world and interact on a daily basis with these NTs. So I encourage you to learn more about neurodiversity. Our DSM hasn't been revised since 2013. As Jill mentioned, we do have trainings that we offer in a wide variety of domains, especially in terms of employment, supporting professors, within the clinical setting too. So please feel free to use these emails we have here and contact us. And then the last thing I had was about the link I put in the chat. The Organization for Autism Research has been partnering with Reaching Spectrum Heights to utilize some of their family guidebooks, and they will mail you one for free. And this one specifically that I like to use is about student-centered transition planning, where especially college soon-to-be grads can bridge that gap between an alumni and maybe the home state that they came from and establishing that new norm in their life. So thank you. That's what we had, Jay. If there's any questions, we can open up the floor for Q&A.
Yes, thank you, Jill and Rebecca. That was great. We really appreciate it. We will share the slides, so you'll have the links to their emails, and we'll share the link in the chat as well. So don't worry if you don't get it here right now. But yeah, let's open it up for some Q&A real quick. Feel free to unmute and start talking, raise your hand, or use the chat.
had a question really quick while everyone else is thinking. You used the term stimming a couple of times. I wondered if you could just give us a definition and a couple of examples of what you mean by stimming.
Absolutely. Sorry, I put the link, I thought, to the website, but it's just reachingspectrumheights.com. Yes, stimming. If you think about stimming behavior, everyone does it in some capacity. It might be clicking your pen. It could be twirling your hair. It might be hand flapping. It could be rocking. Sometimes stimming comes in the form of even internal or external, what's called echolalia, which is the repeating of certain sentences or words that might be calming. And I'll tell a quick story about stimming. One young man that I supported years ago was really obsessed with the movie Ratatouille. I'm not sure if anybody's seen it, but during the movie, it says, "I once killed a man with my thumb." And this is a guy that barely spoke in class, but during a test, he actually got up and did that. So peers were clearly freaked out because, let's just say, Johnny doesn't usually say anything, and it sounded a little bit uncomfortable. Come to find out, he didn't have any context for that, right? And so we could utilize the mentorship with the professor, knowing that he has autism, and this might be a correlation to something else that is totally unrelated. And so stimming can also come in the form of pacing. It might be that students need to take a short break in the hallway and return to class. A lot of people ask whether or not you should stop stimming behavior. And my philosophy is that if it's not harming the self or anyone else, then don't stop. Provide those environments of, let's say, the sensory rooms we were discussing, where people can feel free to stim and then return back to that task. That's my sort of best answer. Jill, you have any stimming feedback?
Yeah, no, you got it. It is a soothing technique to reduce stress, right? So oftentimes you'll see it. It can also be at times happy, right? So there can be times when people are very excited. But most of the time when we see it in autistic college student populations, it really is a coping mechanism for stress, an outlet, a release, a soothing tactic, something to help them regulate.
Great question, though. Oh, thanks, Jay. Anyone else have a question or want to use the chat for comments or feedback? We're hoping this can provide some practical ways that you can help your clients and students. We gave you all the information. You know everything about autism now, right? Go out into the world.
We call that the echo pause, when we just let everybody kind of marinate a little bit on it. And then hopefully somebody will speak up or drop something in the chat.
Okay.
So it's okay.
Don't worry, y'all. I've been a professor for 10 years. I can sit here as long. I mean, we can sit till the end of class. Like, I am seasoned.
Just one quick comment. It's funny that this is today because I already saw one individual on the spectrum this morning for the first time. I'm seeing another one at 3 o'clock today. So I've definitely seen an influx of more autistic or spectrum students entering college and being allowed to and encouraged to do that. I'm noticing the social isolation. I'm watching an intense when feeling comfortable diving into things such as social media with individuals in other states and the like. That is kind of their social group. So it's not a social group on campus among other students. It's still online with other people that they've developed, or gaming. And so a lot of social isolation and the like, and a resistance towards parents' interventions, but parents who still want to intervene. So a lot of helicopter type parenting too, which can be advantageous if you need the parents engaged, but also they're now kind of pushing that away because they've had that all their life and now they want to be socially independent. Does that make sense? But they still need a lot of that connection for success when it comes to making appointments and everything. So I just wanted to bring that up.
Yes. Becca, can I take this one for a second? Codependency with your child is really the only socially acceptable form of it these days. And as somebody who is a parent to a 10-year-old and late diagnosed myself, I can tell you that you spend your entire life fighting and advocating and probably over helping and enabling that child. And so it becomes very difficult when they're making this transition to college and into adulthood to change those the parents' behavior patterns. And, you know, I've even seen this working in Reaching Spectrum Heights. We have a virtual parent support group. And so parents of children who are past college as well, still having kind of those deep levels of enmeshment, still leaning on kind of the old advocacy, I fight model. I help solve my children's problems. And so helping, you know, when we're talking about these college students who are looking for more independence and needing it, but still needing a lot of support, oftentimes their parents also are going to need some support in understanding how the transition works and their role in that transition, and where they still can help, and maybe where they can channel their their energy for helping their child, where it will be helpful to both the child and not over helping, but where there also needs to be boundaries. And so that is something that is really common. You're going to see, and I think it's going to just be an increase overall in parental involvement on campus, but especially in this group that has been so used to and so heavily relied on to get their children to this point. And so oftentimes, you know, there needs to be some sort of, even if you have the opportunity to also talk with the parent, some sort of mediation. Dr. Hansen does this very well with talking to parents of adult children about what their children need to be successful. And a bit of that is, where can the parent take a step back? Where can the parent foster and empower independence? And where can we build in opportunities on campus to test that independence in a safe way? Right. So a lot of the college experience is about testing out independence. And a lot of our students who are autistic have had less independence and more intervention than their typical peers. And so, yeah, absolutely what you're saying with like parents overstepping, crossing down. Trust me, like I talk about it like, you know, I'm not the person who is absolutely susceptible to doing that. I am already trying to change my ways, but that conversation needs to either happen with a parent and somebody who can support that conversation, or empowering that child to advocate for their needs to their parent in a way that their parent can understand, right, and not be hurt by. And so that is a very difficult thing. That's where I would recommend like things like family therapy. We do that, some of that with coaching, with RSH, sitting down with the parent and the adult child and talking about expectations and boundaries, especially when there's still financial support there, which makes it a tad more difficult and complex. And so, yes, absolutely. Not only are they struggling with their own perceptions of independence and trying to do things on campus, they're also trying to navigate a very new parental relationship that the parent is going to try to keep the same in many cases.
Yeah, thank you so much, Jill. I know we're running short on time, and I saw a chat pop up here. Catherine, thanks for asking here. She says, I have had clients with autism express they're scared to apply for certain careers or other resources because they might face discrimination. Right. Are there any incidences like this you have faced? Yes. And how can you handle them or advocate for your client? That's a great question. In fact, back in 2015, when I was doing some research on preparedness skills for employment for college grads with autism, one of the top things that they were unsure about was networking, and how to have that charisma that it takes to get to know other people, which is really the opposite of what they're struggling with in the first place, right? So it can be somewhat of a learned skill. The advocacy part and disclosure is critical. Many people with autism do not want to disclose that they have autism during a job interview. They think, well, if I tell them, then they'll think I need all these accommodations and they're not going to hire me. I'm going to be discriminated against, and it can really prevent gainful and meaningful employment. How I handle it is going back to the self-advocacy piece, because you can provide your employer with information on how to provide accommodations to you without saying I have autism. You could say maybe I have sensitivity to sound, or sometimes the lights are too bright in a certain room, and talk about the needs that you might have before just coming out and saying any kind of diagnosis, if that makes you feel uncomfortable. Does that sort of answer your question, Catherine, or any other examples you want me to share? Because, oh, thank you. Great. And then if you want more resources too, the links to the publications that have been done in the areas of stigma and also in transitioning from high school to college. Supporting parents was probably the most enlightening aspect of starting this company. I've had the opportunity to work with parents for a long time. And I understand what you were saying, Timothy, about that divide between being the papa bear or mama bear, if you will, and high school and having those IEPs, and then transitioning to this higher education level where now I'm signing FERPA releases, or now I can't get access to information that I need for my child, for them to register for classes or pay for tuition, etc. And so I found that the coaching of the family is equally as important, maybe not even as a family unit at that point, because we're talking about adults who have autism, who are developing their new identity and reputation in college, and then kind of being that mediator, if you will, between the parents' goals, be them social goal, they might be social goals, they might be academic goals, and then what the student is really wanting for their life too. So good questions.
I'll also mention is related to the employment is you have students who potentially will not need to disclose that they're on the spectrum to be able to be successful in their work. But what we see is that we do see a high level of individuals who do not retain their employment, oftentimes due to interpersonal conflict or struggles that they have not been supported in. If your student is nervous about that kind of situation, there are companies like Mentra. So they can go to Mentra, which is a job board for autistic and neurodivergent people to apply. And then there are a variety of companies and organizations that also help place people who are neurodivergent into kind of supported workplace programs where they might get a coach for 3 to 6 months. Those organizations include Specialisterna, CAI, the Precisionists. Again, we're happy to share resources, but if you have somebody who says, you know, I'm nervous about disclosing, but I feel like I'm also going to need accommodations, or they have kind of a history of struggling with communication with their coworkers, those soft skills, either coaching, you know, them for that disclosure and how to do it and when to do it, or looking for these companies that are recruiting neurodivergent individuals and partnering with businesses and organizations for employment can be 2 different pathways towards the same goal.
Yeah, I just wanted to quickly mention also for West Virginia folks, the Department of Rehabilitation Services is a great resource for families. If the child is at least 14 years old, then you can qualify for services. And their main goal is employment for people with disabilities, but they've been known to financially support things like needing a laptop or accommodations for transportation, learning things like how to drive. Our support services have been covered by Department of Rehab Services also. So I just wanted to mention that resource in case some of your clients and students hadn't thought of that.
Jill, I was wondering if you could put the resources that you mentioned in the chat, the Mentra job board and CAI and the others.
Yeah, absolutely.
We'll make sure to include those in the recap email to everybody as well. So you'll get it a couple of different ways. Any other comments or questions while we're getting stuff into the chat here? This has been great discussion, great information. I know we're kind of winding down here, but just want to make sure everybody's got everything they need. Just as a reminder, you'll get in the recap email, you'll get access to all the links. You'll also get a link to the session evaluation. We really appreciate any feedback you can give to us on that. It should not take you very long, 3 minutes, something like that, 3-4 minutes at the most. So be on the lookout for that as well. Our next session will be on March 5th. And that's going to be around athlete mental health. And so that topic. So be on the lookout for more information on that, like the reminders and things. And if you have any discussions that you or questions you have that, you don't think really are a discussion form or anything like that, please go ahead and put them in the form and just send that. We don't need all the information. Just send us your questions. So at least we have them ready to go to make sure they get answered for you, or at least get some discussion around them. That's what the purpose of this call is for, besides giving you some information, is also letting us know what you need and what we can help provide, hopefully. So don't be shy about that. And Jill and Rebecca, thank you again for the great presentation and the links and all the information. Do you think of anything in between, now and all that? Just shoot me an email and I'll get it out to the group. Don't worry about that. So we can take care of it.
We appreciate the opportunity.
Thank you
Okay.
all.
I have one
Thank
more
you,
note.
guys.
If this is
Yeah, sure.
if this is your first call or your first call in a while and you want continuing education, if you could just drop your name and your discipline in the chat. That way we make sure not to miss you on the roster. Continuing education 1 unit for social workers, counselors, and the WVCBAPP disciplines.
Okay. I'll hold on here with the session open, give people time to go ahead and put that in the chat if you need to. For the others, if you've got to run, I know we got a couple of minutes, go for it. But thank you, and we'll see you in March.